Hi everybody, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. Well, another day, more crazy celebrity medical diagnosis reported in the news. Controversial psychologist, influencer, pseudo-celebrity, charlatan and former drug addict Jordan Peterson is apparently taking some time off of everything due to a debilitating illness caused by mold exposure. Apparently, he was diagnosed with something called CIRS, C-I-R-S, chronic inflammatory response syndrome, due to a genetic predisposition that causes the immune system to have an inability to identify and detoxify mold and bacteria in indoor air, not outdoor air. This genetic predisposition is not that rare. Apparently, it's found in 25% of people, but he has a severe version, yada, yada, yada. Here's the problem. CIRS, or chronic inflammatory response syndrome, is not a recognized or real medical condition in the current medical literature. The term chronic inflammatory response syndrome is not established in peer-reviewed medical literature, nor is it acknowledged by any major medical society or any clinical guidelines. Yes, we all know that chronic inflammation is a well-characterized pathophysiologic process implicated in a wide range of diseases, including cardiovascular disease, pulmonary disease, cancer, diabetes, autoimmune disorders, to name a few. The medical literature refers to these as chronic inflammatory diseases or low-grade chronic inflammation, not a distinct syndrome called CIRS. So apparently he's treating himself. And since there's no medical condition that has ever been described like this, I can't imagine what he's doing. Clearly, it's not something that has any efficacy. Whether this is an effort to drive more followers to buy his books, products, or attend the Peterson Academy for higher learning, who knows? I also don't know why so many celebrities and influencers want to be sick with diseases that just don't exist and have never been described. You can form your own opinions, as I have done. I'm sure all of them are valid, but what I want to stress is that this diagnosis was apparently made by a naturopath physician, and I need to stress to all of you the fact that naturopaths, chiropractors, and functional medicine doctors are not medical doctors, okay? And that's really important to understand. You know, and getting a certificate from Harvard University for an 8-week course does not qualify you to be an expert in anything. Understand that vague symptoms like fatigue, constant sore throat, upset stomach, nausea, decreased executive functioning, cognitive dysfunction, to name a few, can be attributed to hundreds, if not thousands, of different entities. It doesn't mean you have some disease that needs to be diagnosed and treated. If something really does persist, however, go see a board-certified medical doctor who's qualified in a medical specialty most aligned with your symptom complex. And just because you may not like what you hear does not mean that you are wrong or they are wrong. Sure, you can go for a second opinion, but you're always going to be able to find somebody who will support whatever diagnosis you think you have, even if it doesn't exist, if it benefits you and if it benefits the doctor, okay? So with that, I hope you're having a good day. I hope you learned something. And for more information, you can go to my website at www.paladinmds.com or to my Substack page at doc4heart.substack.com. and subscribe for free, where I write about all different medical topics. And thank you so much for listening, and I appreciate you all very much. Have a great day.